Good morning. I'm actually going to talk about alcohol problem prevention. Treatment will be discussed later. But the first statement of our problem, or our challenge as I see it, is that when you talk about alcohol problems, alcohol-involved traffic crashes, violence, injuries, fetal alcohol syndrome, you're not just talking about dependent persons. So the problem of prevention, the challenge of prevention, is to have a much broader view and to look at moderate and heavy drinkers who may not be dependent, but also in some cases light drinkers. So that's our challenge. That's the domain in which we're operating. What do we know? Well, we have had a number of effective policies, and it's important to recognize them as we set the stage for looking at the future. Probably the single most effective public health policy in saving young lives has been our minimum drinking age. The United States, as you may know, has the highest drinking purchase age, alcohol purchase age, or drinking age in the world. And the public health benefit in terms of saving lives has been enormous, more than any other effort that we've had to reduce harm. Do young people still get alcohol? Of course, and we'll talk about that as a future challenge. Other areas in policy that have been important, of course, are lowering the blood alcohol limits for drinking and driving, especially the area of younger drivers. We have a very low, on almost all states now, a very low BAC, blood alcohol concentration limit for young drivers, and it has been shown to save also a lot of lives. What we also know is that as a legal product, alcohol is sensitive to its price. In other words, as its cost goes up, its use goes down. Now, why are we concerned with that? Because one of the important policies, potential policies, is to use price as a vehicle, and we'll talk a little bit about that. Just recently we had a scientific paper in the American Journal of Public Health looking at the state of Alaska, which in two events increased their alcohol excise taxes specifically to reduce harm in Alaska with demonstrated effects. So what do we need to know? Well, one of the, to me, frontiers, Tom McCullough has already mentioned the communities, is that communities are being asked to more and more assume the responsibility, as they should, for implementing and operating effective prevention strategies. What's the problem? They are not equipped, nor are they mandated in terms of their funding streams to use either epidemiological evidence to demonstrate the size of the problem they want to deal with, so we're left with deciding based on personal preferences and values, but also equally importantly, we are not mandating them to use the best scientific evidence, particularly in the area of policy. I work a great deal with communities across the country, and the single most problem they face is not that they can't understand the scientific journals, but what do they make of it? How do they actually turn it into something they can actually use? So the first question from a policy point of view is, what is the policy we need to require this, to support this, to emphasize it, beyond Tom's very meritorious idea of giving special funds, but also as a part of the regular stream. A second area is, what is an effective excise tax that could be applied? Alcohol taxes, since the ending of American Prohibition, have been looked at largely by states as a vehicle for revenue. Very rarely, Alaska I mentioned as an exception, have states implemented price increases specifically driven by public health. So what kinds of changes should we be making in our policy, tax policy, excise tax policy, retail minimum pricing to be most effective? That's simply an important untapped research area. A third area, what's the most effective mix of strategies to prevent underage drinking and to delay initiation of drinking by youth? Well, you say we already have a highest drinking age. What's the problem? The problem is there are many factors affecting the success of that policy. And that's where we need research, and it's no single event, no single activity, no single resource is sufficient. It's clear to us now that it's a nexus of elements that make our minimum drinking age effective. The other area that we really know very little about is how do you delay initiation of drinking. What the evidence shows us is that the earlier young people start to drink, the greater at risk for harm both during adolescence and young adulthood, but later alcohol dependency and alcoholism based on the age of their first drink. How do we delay that? That's a major policy area that we need research. And last, at least in this slide, what are the policy strategies that are potential to reduce violence, particularly domestic violence? What we now know very clearly, as for example, there's a strong association between the concentration of alcohol outlets, bars, restaurants, liquor stores, and domestic violence, including child abuse. So what does that mean from a policy point of view? What are the research issues that we need to be addressing, particularly at a local level, at a community level, in terms of affecting that density as it might reduce domestic violence? Now, I've just given you the highlights, as Michael did. I encourage you to look at the full report, which contains a great deal more detail about alcohol problem prevention and what we know and what the future should hold. So our next speaker will be Marjorie Gutman talking about drug prevention.